Latest on the COVID-19 outbreak from Georgia Governor Brian Kemp. We go live now to Atlanta, where the governor is holding a news conference at the state capitol.
Georgia Emergency Management and Homeland Security Director Homer Bryson, all of the people operating under the direction of these leaders standing behind me are truly remarkable, including them. They've been working, as you can imagine, long hours with very little sleep. I also want to thank all those hard-working Georgians under their direction that are committed to the health and well-being of our citizens, and thank them for how hard they're working as well. We are blessed to have the best and brightest on the front lines of this fight. As of noon today, we now have 4,638 cases in Georgia, spanning 139 counties, with 139 deaths due to the COVID-19. Our thoughts and prayers continue to go out to the families, loved ones, and communities of those that we have lost to this terrible virus. So far, the state lab has processed 2,100 tests, and commercial vendors have now processed a little over 18,000. As many of you know, testing in Georgia has increased rapidly over the last couple of weeks, but our capacity has been limited due to the number of reliable and available tests. And as many of you here have reported, competition among states for access to commercial labs is obviously at an all-time high. Testing is an important tool for identifying cases earlier, targeting hot spots in our state with more resources, developing models, and providing timely information to the public. These tests are vital to our frontline workers, Georgia's doctors, nurses, and respiratory therapists, our first responders and law enforcement, as well as the medically fragile populations, including those living in long-term care facilities and the elderly. In short, tests define the battlefield and help us to develop a strategy to win this war. Yesterday, I was proud to announce plans to quickly and dramatically increase the availability of testing for COVID-19 in our state. This proactive and timely initiative is leveraging laboratory resources under the University System of Georgia, the Georgia Public Health Laboratory, and Emory University to rapidly enhance surge capacity. This is a unique public-private partnership, which was announced and set into motion yesterday, for us to start processing over 3,000 samples a day. As you know, from the beginning, we have used data, science, and the advice of healthcare professionals to determine our preparedness and relief efforts. These new testing numbers will provide a better picture of COVID-19's impact on our state and continue to inform our decisions as we move forward. I want to pause just a moment and thank the University System of Georgia, Chancellor Steve Wrigley, Dr. Toomey, and their respective staff for their hard work on this important partnership. We want to assure Georgians in every part of our state that expanding testing remains a top priority for me, as well as those that are standing behind me today. We all know that the status quo is unacceptable, and I certainly appreciate their innovation. We will continue to innovate and push so all Georgians who need a test for COVID-19 can do so in a safe and convenient way. Since forming the Coronavirus Task Force in February, we have announced several orders to keep our families as well as our communities safe. We are in this fight together, and I want to share once again how we can flatten the infection curve in Georgia. To stop the spread, we must practice social distancing. To mitigate the risks, it is best that you stay home. For the most part, Georgians are heeding this advice, and I couldn't be more grateful for that, especially in the metro area. As you can see, traffic has lessened dramatically. We have folks teleworking, attending church online, getting takeout or delivery for meals, and postponing social events for the greater good. These are personal choices, and they are not easy. But when Georgians listen to the guidance provided and follow the orders issued, they are actively joining the fight against this deadly disease. When hard-working Georgians limit their travel, limit their interaction with others, and limit their activities. They are buying us more time to get additional hospital beds ready, order supplies, and continue to prepare for more positive cases. All of us know that this fight is won at the community level, not at this state capitol behind us. To win this war, we have to hunker down and continue to chop a lot of wood. I was really taken by the President's coronavirus press briefing yesterday and what Dr. Birch had to say. And she echoed these truths. It will be the hard work of people in cities, towns, and communities across our nation, following the advice of healthcare experts and making change to their daily lives to fulfill a higher calling. And that is what we are seeing in Georgia. As you know, our people are determined and they are resilient. We will accept nothing short of a victory over this virus. I know full well we have many challenges ahead of us, but we have plenty of opportunities as well. I want to encourage my fellow Georgians to hang in there. I know that you're tired of this. I know you want to return to business as usual, but we must first overcome the obstacles that we have in our path. By doing this, we will get through this together. There's no question that these are unprecedented times, and state officials are taking historic measures to meet the needs of the healthcare providers, hospitals, patients, and communities across our state. Teams at the State Operations Center and the National Stockpile Warehouse are working around the clock to identify needs, strengthen the supply chain, ensure that we have a plan for any scenario. As of this morning, we had 3,520 medical surgical beds, 450 beds, and 1,006 ventilators available in our hospitals across the state. According to the Institute for Health Metrics and Evaluation at the University of Washington, Georgia will reach peak hospital capacity on April 23rd. That's nearly 3 weeks from today. This model assumes that Georgians continue to abide by the state's orders and use social distancing methods through the end of May. These numbers, as you know, are updated on a daily basis, and we are continuing to monitor capacity. State officials, I can assure you, are working closely with Georgia Hospital Association, the ambulatory surgery centers, to take a full inventory of beds and ventilators. We also are spotting trends to prepare for the days and weeks ahead. So far, we have purchased 4 medical pods, which are basically steel shipping containers that have been converted to mobile units with beds as well as equipment. Each unit offers 20 to 24 beds with a nursing station to treat patients as they arrive. These will be a state-owned asset that will be able to quickly deploy to hard-hit areas. We have submitted a request to FEMA to staff these pods using military medical providers. To expand current bed capacity, I have temporarily suspended Certificate of Need laws. Now, Georgia healthcare administrators are reconfiguring existing hospital wings or embarking on new construction to address the looming concern. Commissioner Frank Berry with the Georgia Department of Community Health is working with multiple hospital systems to reopen closed facilities for use. I want to take this opportunity to give a big shout out for Phoebe Putney, HCA Healthcare, and Piedmont for going above and beyond the call of duty. These systems have engaged the state to reopen several facilities and bring hospital beds online as we prepare for the potential patient surge. As many of you know, Dougherty County is one of the hardest hit areas in our state. To date, we have shipped necessary supplies and planned more shipments based on the needs of Phoebe Putney's system in the future. The Department of Public Health has deployed an epidemiology team in coordination with the Centers for Disease Control and Prevention. We have also deployed 2 National Guard medic teams to this county. The 2 Guard units are assisting existing staff at Phoebe and a nearby nursing home facility on everything from administrative needs to medical treatment. As General Cardin will explain, these units are brand new. They were created specifically for this purpose. That is an incredible testament to General Cardin and his team that they were able to identify, mobilize, and successfully deploy these soldiers in such a short period of time. As reported, the state has worked closely with local health officials to establish more bed capacity at Phoebe North and provide staffing and equipment necessary to relieve Phoebe Putney Memorial Hospital. We expect Phoebe North to be completed and ready to treat patients as early as next week, the first part of next week. I've had several conversations with Scott Steiner, the CEO of Phoebe Putney, multiple times over the last week, as well as Daugherty County Commission Chair Chris Cahias, Lee County Commission Chair Billy Mathis, the mayor, and many other local leaders. We continue to all do everything in our power to ensure that Daugherty County and surrounding communities have the resources and support that they desperately need in this crisis. As I mentioned a moment ago, the Georgia National Guard has identified new teams to replicate the units sent to Albany and Daugherty County at similar hotspots around our state. And just yesterday, the Georgia Guard announced another innovative way to stop the spread of coronavirus across our state. This virus is deadly, as you know, but it's even more dangerous when left unchecked in a long-term care facility. To assist the operations and managers of these facilities to keep their patients and residents safe, we will activate over 100 guardsmen to deploy to any long-term care facility, assisted living facility, or nursing home that has COVID-19 patients. These troops will implement infection control protocols and enhance sanitation methods to dramatically reduce COVID-19 exposure amongst vulnerable residents. Going forward, I cannot overstate the importance of nursing home facilities and long-term care homes following the public health guidelines. Our task force is in regular communication with the Georgia Healthcare Association to make sure these facilities are receiving accurate, up-to-date information from the Department of Public Health and from the Centers for Disease Control and Prevention. In the weeks to come, the Georgia National Guard units will have boots on the ground to assist those operations and continue to ensure we're protecting our most vulnerable citizens. As I previously mentioned, on March 23rd, I issued an executive order banning gatherings of more than 10 people unless they are at least 6 feet between each person at all times, and requiring medically fragile Georgians to shelter in place through April 6, 2020. I've signed several executive orders lifting restrictions on getting more doctors, nurses, pharmacists, and pharmacy technicians to work, closing K-12 schools through April the 24th, and raising the amount of unemployment benefits available to Georgians facing financial hardship. I've also authorized the State Board of Education to waive certain rules, regulations, policies, procedures, and provisions to assist in the state's response to COVID-19. We're also allowing the use of real-time audio-visual technology to assist in notarizing real estate documents. And among other actions related to future revenue, I've directed the Commissioner of Revenue to implement waivers for Conservation Use Value Assessment and Forest Land Protection Act applications. I've transferred additional emergency funds to pay for more supplies and equipment, and I continue to appreciate the support of the General Assembly, the Speaker, the Lieutenant Governor for their support in the emergency funding and the amended budget. All of those measures have helped us prepare for the weeks ahead as we fight this pandemic facing our entire country. We are constantly reviewing the data, the modeling, and the science. I'd like to thank GEMA Director Bryson for completing the isolation site at the Georgia Public Safety Training Center in a very short period of time. We currently have 5 patients at the facility, which have a maximum capacity of 40 individuals. Like the site at Hard Labor Creek State Park, this facility is for patients that are not able to isolate themselves, and we'll continue to have this resource available for individuals that need it. As we continue to fight this virus, our office is receiving reports that are concerning and deserve the public's immediate attention. We have been told by one area Atlanta hospital that they are seeing a 15% increase in domestic violence cases at their facilities. This is disturbing and alarming, and it cannot be tolerated. If you or someone you know needs help, I would ask you to call the Georgia Domestic Violence Hotline. That number is 1-800-334-2836. Again, that's 1-800-334-2836 for the Georgia Domestic Violence Hotline. We are also seeing a reduction in reports of child abuse, likely a consequence of our educators not having as much face time with Georgia students. Teachers and administrators are often the first ones to see the signs of abuse, and now with schools closed, we must remain vigilant about this problem and continue to work to remedy it. If you are a child in crisis or know of someone who needs help, I would urge you to reach out to the Georgia Department of Family and Children's Services at 1-855-GA-CHILD. That's 1-855-422-4453. And finally, my office has received dozens of calls and emails from many hardworking Georgians out of work, many who have had their hours cut back, or business owners that unfortunately have had to close. And as someone that has spent my entire career in the private sector, I know the economic impact of this global pandemic. Georgians have to feed and clothe their families. They have to pay rent, utilities, and buy gas for their vehicles. The reality is that a government check will only pay for so much and go so far. Hundreds of thousands of Georgians are facing financial ruin because of this virus. As many of you know, I was a builder and developer during the Great Recession. Literally in those days, we lived hour to hour, day to day, and week to week. I have been there before, trying to support my family. It is a frightening thing, to say the least. So for those waitresses who have lost their job, or small business owner who doesn't know if they'll make payroll this week, or the hourly worker who barely made rent today, I hear you, I am praying for you, and I will promise you we continue to work hard every day for you. I want to thank Commissioner Mark Butler. He has done a great job streamlining the unemployment benefit process, and we were among one of the first states in the Southeast to be approved for the expanded Small Business Administration loans. We have also extended the state tax filing deadline to match the federal deadline and issue guidance to workers looking for hourly jobs to get through the next few weeks. We will continue to do whatever it takes to help keep our families safe and ensure a strong and prosperous future. These are difficult moments as a nation and as a state, but these times, as you have seen, bring out the best in us. They remind us of the good that still exists in this great state and world which we live in. I want to thank the many, many people in our business community who have stepped up to do their part to fight COVID-19. Georgia's own Home Depot is donating millions of dollars in PPE and other products, prioritizing fulfillment orders to hospitals, healthcare providers, and first responders. Honeywell, an industry technology manufacturer who has a hub here in Atlanta, is ramping up production of N95 masks from a new facility in Rhode Island and another one in Arizona that will come online in May. They've already doubled their production of N95 masks, and within the next 90 days, they will have 5 times the capacity to produce these critical healthcare supplies. In local communities across the Peach State, we've seen small business owners completely repurpose their staff and production lines to make other materials that are in short supply. One is not far from here. Old Fourth Ward Distillery has begun producing hand sanitizer. And TSG Resolute in Americus, Georgia, has a partnership between Coca-Cola and Georgia Tech here in Atlanta. And businesses are finding ways to innovate to manufacture protective surgical shields and masks for healthcare workers who are on the front lines every day. As you know, over the past few days, the White House has issued new federal guidelines and a timeline for mitigating the spread of coronavirus. Public health officials are discouraging large gatherings, advising the elderly and anyone with underlying health problems to stay at home, encouraging people to telework, and keeping kids from school until April 31st. Georgia's order reflected the guidance and direction from President Trump and his coronavirus task force. I have empowered numerous agencies and officials to enforce them. The Georgia Department of Natural Resources will limit gatherings with officials patrolling bodies of water as well as campgrounds. They are monitoring coves where people tend to congregate, and if necessary, they're using bullhorns and other methods to get people to disband. Officials will approach people and demand compliance with our orders for the well-being of all our citizens in our state. Local officials are also working hard to ensure compliance with local directives, which vary by city and county across our state. The Georgia State Patrol is prepared to take appropriate action to ensure full compliance, no exceptions. The reality is, if you do not comply, you are violating the law and you will be facing stiff penalties. Even worse, you are literally endangering the lives of those around you, your loved ones, and all fellow Georgians. In Georgia, the safety and well-being of each citizen comes first. We will do what is necessary if people fail to comply. Thousands of Georgians have used the power of social media to tell people about these orders as well as to hold people accountable. I would like everyone to keep doing that, folks. It has been a huge help to us. To all of those people who have reported non-compliant businesses and organizations to the COVID-19 hotline, thank you. We are following up on these complaints and have had a great reaction from companies to do what is right for their employees and the people they are serving. Many of our state's most beloved brands out there are setting an example for others, like Home Depot, Chick-fil-A, and many others. We appreciate their leadership during these very difficult moments. I would encourage everyone to continue to stay safe. Enjoy your time with your family and continue to follow the directives to mitigate the spread of this virus. Do your part to urge your friends, neighbors, and coworkers to do the same. In keeping with our promise to let data and experts guide our decision making, I am announcing another measured strategic step forward. As you know, over the past 48 hours, the modeling and data has dramatically changed for Georgia and many other states around the country. The CDC has announced that individuals can be infected and begin to spread coronavirus earlier than previously thought, even if they have no symptoms. From a public health standpoint, this is a revelation and a game changer. In addition, new models show that Georgia will need more time to prepare for hospital surge capacity, and while we are making excellent progress with our team, we have got to be more aggressive. For those reasons, and in accordance with Dr. Toomey's recommendation, I will sign an executive order today closing K through 12 public schools for the rest of the school year. I want to stress that online learning will continue. I want to thank all of the educators and superintendents that have stayed in touch with us through this process to make the best of a tough situation. We will continue to work with them on the path forward. Tomorrow, I will sign a statewide shelter-in-place order, which will go into effect on Friday and run through April 13, 2020. This date is in line with our public health emergency order. Dr. Toomey and I will continue to work day and night to finalize the order to make sure it keeps our citizens healthy and protected in every zip code across our state. We are taking action to protect our hospitals, to help our medical providers, and prepare for the patient surge that we know is coming. This action will ensure uniformity across jurisdictions for Georgia sheltering in place and help families and businesses be able to comply with its provisions. We will publish the order tomorrow and issue detailed guidance so Georgians can get prepared. We will continue, as I said, to monitor the data and make sure that we make adjustments as needed, keeping members of the public informed every step of the way. When I announced my campaign for governor 3 years ago today, I told a crowded room of supporters in Cobb County that there would be difficult days ahead for us, but that I would remember Joshua 1:9. Be strong and courageous. Do not be afraid. Do not be discouraged. The Lord your God will be with you wherever you may go. Years later, know that I still believe that with my entire heart. Doctors, nurses, medical staff, be strong and courageous as you have been. To our first responders, everyone else on the ground fighting this fight from a medical perspective, truck drivers, grocery store workers, food delivery workers, be strong and courageous. Mothers, fathers, sisters, and brothers, be strong and courageous. Hard-working Georgians from every corner of our state, now is the time to fight and continue to be strong and courageous. We are in this together. We are going to win this together, and we're not going to leave anyone alone. So be strong and courageous. Thank you all, and God bless you, and I'm now going to ask Dr. Toomey to come up and give you an update from her end. Thank you, Dr. Toomey.
Thank you, sir. Thank you very much. It's hard to believe that it was just about a month ago we first met to announce the first 2 cases of COVID-19 in Georgia. At that time, those cases were due to travel, and we recognized that we had to address the situation. Since those first 2 cases were recognized, we have seen a change in the pattern of transmission in our state. From what was related to travel has now become, in many parts of our state, widespread community transmission. And recognizing that, we feel the time is appropriate to take very aggressive community mitigation measures to address spread. Even in those areas with relatively few cases, there's still moderate transmission, and we can't let the fact that relatively few cases are in an area. We have not been testing everybody. We have been testing only those who have symptoms and those who are the most ill. And now we recognize what was, as Governor pointed out, for us, a game changer in how our strategy to fight COVID has unfolded. We realize now that individuals may be spreading the virus and not even realize they have infection. As many as 1 in 4 people with coronavirus don't realize they have infection because they have no symptoms whatsoever. And even if symptoms begin, you can transmit it earlier than expected. And so we felt that the time was now to take some more aggressive measures. As you have heard, we have now in the thousands of cases. We have 47 long-term care facilities with outbreaks that we're investigating. We have outbreaks related to prisons and jails. We have had at least 5 outbreaks that we know of related to church gatherings and more related to funerals. And so every possible situation where people are in a congregate setting or gathered together can be a potential site for transmission. And so we really ask everyone to think about how we can work together with you and your community. As we've said so many times before, not only protect yourselves and your family, but please take responsibility for your community as well, because it will be your actions that protect the community as a whole. We had said before, don't go out if you're ill. But now we're saying, please stay home and don't go into settings where you can expose others until we have a chance to stop this ongoing transmission in our communities. Our goal, as you have heard from the governor and from others, is to try to stop transmission so that we don't overwhelm our hospitals. We're trying to ensure that other cities in Georgia, like Athens, like Macon, like Savannah, do not become like Albany, which now is fighting the worst fight of any place in Georgia and has among the highest rates of COVID-19 in the country and in the world. And so I just want to thank everybody in advance for their cooperation, for their respect for each other and their families and their communities. And most of all, I want to thank, from the bottom of my heart, all the medical personnel in the hospitals, in the communities, healthcare workers, and my own public health staff who have been working night and day to try to fight this virus. And together we will win. And thank you very much.
All right, well, thank you, Dr. Toomey. Now I'll let General Cardin give y'all an update on the many activities of the Georgia National Guard. General.
Thank you, Governor. Just to give you all a brief update about the Georgia National Guard and what we're doing in the COVID-19 response, we've developed and deployed 13 medical support teams to the regional coordinating hospitals across the state of Georgia, as the governor mentioned earlier. We're in the process now of building and deploying infection control teams to assist in long-term facilities, assisted living, and nursing homes. We're manning 7 food banks to make sure Georgians are fed. We're supporting the Georgia Emergency Management Agency's isolation facilities, and we're providing logistics support to the Department of Public Health. I'll tell you all what I tell our soldiers, airmen, and members of the State Defense Force. This is when we live our values. I'm so very proud to be a part of this team and to serve the state of Georgia in any way that I can. And I'm very proud of the men and women, our first responders, our healthcare workers, and those who wear the nation's uniform who are getting after this fight against this invisible enemy. And I agree with the governor and Dr. Toomey. There's no doubt in my mind that we're going to prevail. Thank you all very much.
Folks, we're going to open up for questions. Like I said, just use the mics in the back here. We'll start off with Greg.
Governor, can you hear me okay? Governor, there's been a lot of officials, politicians, mayors, county commissioners who have been asking for this step for a very long time. What was it that led you to take this step today? What do you have to say to them about why it took this long? And secondly, will you also be calling for a delay in the May 19th primary?
All right, I'll try to remember all those questions you asked me, Greg. First of all, on the election, the attorneys that I've talked to, I don't have the authority under this order to delay an election. Obviously, I know there's been a lot of talk about that. I, as you can imagine, haven't been focused on that myself. We've got our hands full in the COVID-19 fight. I think it's the reason I'm taking this action. Just like I've continued to tell people, I'm following the data, I'm following the advice of Dr. Toomey. Her and I both mentioned in our remarks, finding out that this virus is now transmitting before people see signs. So what we've been telling people from directives from the CDC for weeks now, that if you start feeling bad, stay home. Those individuals could have been infecting people before they ever felt bad. Well, we didn't know that until the last 24 hours. And as Dr. Toomey told me, she goes, this is a game changer for us. And I've been listening to her advice. I think the other measures that we've taken previously, if you would look at our order and the things that we did, ordering every business to adhere to strict social distancing guidelines, shelter in place for the elderly and or the medically fragile, and the putting a ban on the large gatherings. If you compare that to other states that had shelter in place but had all kind of exemptions and exceptions and essential businesses, we had as strong an order as anybody in the country. I think the issue is we still continue to have people that are not taking this seriously. I'm very thankful to those Georgians that we have that have, literally been staying home with their families unless they were going to their place of employment. I had people texting me all over the weekend that are in the construction industry saying, we have implemented social distancing on our job sites. We're doing our part, and I know there's many people that have done that. Grueling decisions by small business owners that I've read about that had to close a pizza restaurant because their customers wouldn't comply with what they were trying to do. So for the good of the public, they shut it down. That had to be a grueling decision for those people. I'm very thankful for the federal support that we've gotten from the president, the vice president, our congressional delegation, with the unanimous support of the Senate stimulus bill. I know that money will begin flowing quickly. That's going to be very helpful to people that have lost their jobs or have limited hours. The SBA loan process, our local banks and many other people, including our team, are working very hard to put that information together to get that in the works very quickly. So I think all of those things are going to help. But as I said earlier, we've been following the data, and I've been following the advice of the task force and the health officials. And there's been all kind of models and different things that we're looking at. But I think this new model that we're following every day, based on guidance on what the president and Dr. Birx and Dr. Fauci said last night, is going to be very helpful for the states as we move forward.
Governor, once again, what are the dates of the order, and what will be different under this order compared with what we're already under, and how are you going to enforce it using the State Patrol and other law enforcement means?
We're definitely going to be enforcing it with state law enforcement and other people that have the ability to deputize under the power of the public health emergency order. Exactly how that looks like is something that we're going to be, we're going to have a lot of information in this order. That's one of the things that I think is really hard about a shelter in place is it's going to take a lot more, I think, detail in the order than what we had before. I've had concerns about that confusing the public, but at this point I think it's the right thing to do, and I'm going to rely on Dr. Toomey to help me write that the rest of the night and in the morning, and we'll have the details in the order. It'll go through our public health emergency order of April 13th.
And just to follow up, so you anticipate there will be in this detailed order some exceptions for grocery stores, pharmacies, things like that?
Yeah, look, people have to eat. We have to continue to process our food supply. We have to have pharmacies open. We have to have Georgia-based companies that are making PPE, medical supplies, and I've heard from a lot of these people. These are hard things to figure out, just like a packaging company. If you make the medical supplies, somebody's got to make the packaging that it goes in to keep it sanitized on the way to the healthcare facility. So we're working through all of that, and we'll have that ready to go tomorrow with guidance.
Governor Kemp, did I understand you to say that the tipping point for the shelter-in-place order was that you've learned in the last 24 hours that people who are can be asymptomatic throughout the disease and still spread? It seems like that's been clear for a while.
Well, I'll let Dr. Toomey speak to that, but we've been doing 2 calls a day, every day, for well over a month. And last night, Dr. Toomey said on that call, and we talked about it again today, that this new information that came from CDC was a game changer. So I'll let her speak to that. Dr. Toomey?
Sure, thank you. I think we knew, you could tell from the pattern of spread, and we knew from the cruise ships that there's likely asymptomatic transmission. CDC guidance and our own testing patterns were to test those with symptoms. And so all of our epidemiologic models were based on people with symptoms. And I think it's a combination not only of recognizing that there's probably a large number of people out there who are infected, who are asymptomatic, who never would have been recognized under our old models, but also seeing the community transmission that we're seeing and recognizing now is the time to stop that transmission before the hospitals get overrun. And this is something that the governor and I and the task force talked about at some length, and I think that the important thing is the action is being taken, and we really need the public's cooperation to ensure that this is valued and also respected. I can tell you that even in my own community, I still have people say to me, I don't understand why you're so upset about this. This is just like the flu. This is absolutely not just like the flu. It's many times more transmissible. It's and it's also much more deadly, and we have absolutely no immunity to this. We don't have a vaccine. We don't have our bodies were not exposed to this before, so we can't fight this off. So we see as the pattern of deaths has occurred, those particularly elderly and those with chronic health conditions are most at risk, but everybody is at risk for infection. And I think the time is now to try to stop that community transmission.
You've been listening to Governor Kemp's news conference regarding the latest on the COVID-19 outbreak, and the lead is that the statewide shelter in place will be in place as soon as he finishes writing up the declaration and getting it signed. And that is coming in the next 24 hours or so, starting on Friday, he said originally. That statewide shelter in place means it's no longer voluntary. You're ordered by the governor of Georgia to stay in your homes and be safe. And today, the governor joins the Florida governor, Republican Governor Ron DeSantis, and at least 30 other states in issuing a statewide shelter-in-place order. Also, the emphasis on trying to save lives was made clear by the governor at the very start. He mentioned that as of noon, 4,638 COVID cases in Georgia, 139 deaths. Just a quick local sample of a spike of sorts. Chatham County, 36 now, and the other counties in our area go down from there. Glenn County, 18, Bryan, 8, and then other counties less than there, but everyone has at least one case.